Hello, it's Alan. I'm hoping I don't pass out right now because I'm doing this video in my car with the windows closed so no one can hear me because I didn't feel like I quite had privacy that I feel comfortable with at home. And it's really hot. Extremely hot. Okay, so I'll try to make this quick. So, I just made an appointment for an annual exam, like with a gynecologist, and I'm proud of myself for doing that. It took a lot of courage, and this is something I've been working on slash putting off for many months, because the first time I tried it, I tried to make an appointment with a doctor who had worked with a trans woman that I know, trans women who had had lower surgery, so that made it a little bit easier to call, but it was still really stressful. Turned out they didn't take my insurance, so I didn't want to do that. So now, months later, it's just been really weighing on my mind. I mean, not that I have much reason to think that anything would be wrong with me, it's not like I don't have that many risk factors for, really needing a pap smear, but, I'd rather just do it and not have to have that in the back of my mind. Or, of course, I'd rather just do the appointment and not have cancer that goes unnoticed for a long time. Nobody wants to be in that situation. So, it's been weighing on me, so I decided to do something about it. So, I looked around online and I found a women's health place in my town that takes my insurance, and I saw like a short little video that this one doctor did just talking about her approach to patient care. It was sort of generic, but my gut feeling was that she seemed good. So I called this place where she works as a doctor, and it took me a really long time to think of what exactly I should even say. Oh my god, I'm suffocating. I have to open the window. Tell me if you see anybody coming. um, so I really brainstormed. I was like, what should I even say? So what I ended up saying when this receptionist answered the phone was, so I've heard some good, or no, first I said, I was wondering if you could answer a question for me. And she's like, yeah. I said, so I've heard some good things about this doctor, which was sort of an exaggeration because I didn't really know much about her. I said, but I'm transgender, so I was wondering if she's open to working with transgender patients. And so the receptionist was like, oh, well, yeah, but there's just one problem. So I was like, and she said, so she's leaving the practice in a month. Of course, wouldn't you know it? But then the receptionist, thankfully, said, well, if you want, I could ask if any of the other doctors would see transgender patients. So I said, oh yeah, that'd be really helpful, thank you. So she got my name or something, and then I was on hold for a really long time. And just a side note here, I mean, of course, wouldn't it be nice if it wasn't a thing, like, where she had to ask if they would see transgender patients? I mean, I don't like the concept of that. It's like I'm a human being who has the organs that they specialize in working with as doctors, so it's like if they don't see transgender patients, that feels discriminatory, basically. But, so anyway, she asked. That was really helpful, because I don't want to go around making a ton of phone calls if it takes me a few months to get up the courage to make, like, one phone call. So, after being on hold for a long time, she got back to me and she's like, hi, Alan, so Your options would be this one nurse practitioner or this doctor, so and so. And this doctor is a man, kind of an old guy, apparently. And so I wasn't thrilled about that. I've never been to a man OB-GYN. Um, but, there's that old cliche, beggars can't be choosers. Not that I want to see myself as a beggar in this case, but it's like, well, just, it sounds like he's open to it, so I'll go with it. So I made an appointment for a week from today. So I'm glad that I've done that. Oh shoot, is this covering the speaker? So I made an appointment. Of course I'm nervous about it. It's going to be a very challenging day, psychologically. And I have especially mixed feelings because it's like, on one hand, apparently this guy is open to seeing a trans patient, which is good, but then on the other hand, he's kind of old, and not that I want to make judgments about people based on age, but it's like, just because of how our culture has changed recently, people who are on the older end of the spectrum did not grow up with that, so who knows what kinds of prejudices they might have, statistically speaking. And then also, after having this phone call, I checked the little blurb about him on the health facility's website, and it said he's interested in blah 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 blah, and he has all these kids and he's active in his church. So I was like, that may or may not be a good sign. So that makes me a little nervous, more than I would be otherwise. And I think it might be an evangelical type of church because one of his children, I think, was in my high school class or somewhere around my age at my high school. And I never had anything to do with her, but I have a vague memory of her being involved with, like, evangelical church stuff, because a lot of the kids at my high school were. Nothing against people's religious choices, but, it seems like, in terms of probability, a lot of evangelical Christians discriminate against trans people, so, yeah. Okay, yeah, so I'm nervous. So, something that's bouncing around in my mind is that I know of this other doctor where I used to live, like 3 hours away from the small town where I currently live, and this other doctor, OB-GYN, was recommended to me by my endocrinologist back where I used to live. And today, just out of curiosity, I read this other doctor's blurb online, and it says that she is particularly interested in serving LGBT people. So it's like, well, that would totally put me at ease if I were to have an appointment with her. But it's 3 hours away. Which wouldn't be that bad, because, in theory, I would only be seeing this doctor once every 2 or 3 years. Because I've never had an abnormal pap result. And then for a hysterectomy at some point, I would imagine. So driving a long way is not that bad in that sense, but what if something were to happen and I needed a doctor and it would not really work to drive 3 hours one way for it? Like, what if, like some trans guys, I ended up having, like, abnormal, like, bleeding or other symptoms all of a sudden? It's like, you don't want to wait a long time or drive and take, like, a full day off of work to go deal with that, or heaven forbid if there was some sort of emergency. Or, like, if I have a hysterectomy, wouldn't it be nice to not have to deal with, like, driving, finding a place to stay in this other city, like, staying away from home for a while, and then coming back home, and then what if something gets messed up, like, 2 weeks after the surgery, and I'm a 3-hour drive away from the surgeon. So I kind of want to have a local person, but I am a little torn, certainly. But, I kind of actually have this feeling at this moment, like, after making the phone call, like, why not just give it a try? Like, what's the worst that can happen? I guess I feel a little more sort of strong or something after having made the phone call. Because it's like, okay, I go, I have the appointment. What if the guy is not really that nice, or if I have a bad feeling about it? I can recover from that. I have a good support system with family and friends and my own psychological stuff, from having done therapy for a few years. So I could feel that I could deal with that. If it doesn't work out with this doctor, then go to the one that's 3 hours away. And then I wouldn't be wondering, like, oh, this sucks driving 3 hours. I should have just gone with the person in my town. So, I could just give it a try. And that would give me information. So I'm thinking that I'll do that. And, well, perhaps I will report to you on how that goes and what I do to cope with the stress of that type of doctor visit. So this is sort of a long video, as always. Why would I think that it wouldn't be? But something that I've sort of learned from therapy, and that I would recommend to you guys, if you're in a position like me trying to find a doctor to make an appointment with for an annual, like, pelvic exam, when you're calling, it could be good to make a plan of what are you going to do after you make the call. Like, if it doesn't go as well as you might hope, what are you going to do? Like, could you call a friend? Could you go for a walk? Could you do something fun? Do something that is good for you? I think it's always good to think about that, to have sort of a plan to take care of yourself when you're doing these stressful things. It sounds sort of, what's the word? I don't know. But it's useful. So I'd recommend that. And, obviously, it's really good to, as with any situation, it's good to be polite to the receptionist who you talk to, sound friendly, because I think, I'm not saying, like, suck up to somebody to get them to treat you well, I'm just saying what you put out is what you get, often in life. Not all the time, of course. It's totally possible for you to be really nice and sound confident and polite, and somebody still can treat you badly, yes. But I don't know. I feel like if you kind of work yourself into a good mental space and, sit up straight as you're talking on the phone, because that biofeedback makes you feel more confident. That's a fact. And then, think about the other person, think about what they're hearing. If they work at a women's health place, they're probably going to be surprised to hear a man's voice asking for an appointment. So with that in mind, that's why I mentioned pretty much right off the bat that I'm transgender. Because if I was like, hi, I'm Alan, I'd like to make an appointment, then she might be like, did you know that this is an OB-GYN clinic? And then I'd have to go like, oh, well, yeah, I'm actually transgender, blah, blah, blah. So I could avoid that small, awkward moment just by coming right out and saying it. Who knows? Maybe maybe somebody else has like a genius way of going about these phone calls, like a much better dialogue than what I thought up. That could be possible. If so, I'd be very interested to hear about it. So it's not like this is the world's best recommendation, but it worked for me. And I'm just thankful that the lady on the phone was nice and respectful and helpful. I'm definitely made sure to thank her. So, I guess that's probably about all I have to say for now. I've got to get going, because I'm, like, dripping in sweat. Alright, well, as always, thanks for watching, and thank you for your support, everybody. I appreciate it. See you later. Bye.